Africa, you'll be free.
I believe, Mama Africa, you'll be free.
From Avenue infection, the race of tradition, and new methods of prevention.
Good afternoon, Sam. Good afternoon, colleagues. Greetings from Abuja, Nigeria. My name is Olaide Akoni. We're happy to be here, and the Touch has been with us for the past 1 week, and we've been having a wonderful session with the Touch. We've had different stakeholders talk about how the Global Fund has impacted on their lives, and we're happy to pass on the torch to our comrades in Ghana. But before we do that, we have a few goodwill messages and remarks from the Nigerian team. So I'm going to invite the first vice chair of the CCM, Mrs. Maureen Onia, to speak to us very briefly.
Thank you very much, Olaide, for introducing me. And I am here to speak on behalf of the CCM Nigeria. I bring you fraternal greetings from the Minister of Health of Nigeria, who is also the chair of the CCM Nigeria. And I am going to speak strictly on what the minister have asked me to say in this official occasion. While I am talking, I'm going to look at what Global Funds has been able to do briefly in Africa. Though, as we all know, Global Fund was created as a financial in their needs to fight the scourge of HIV, TB, and malaria, and of course, to revive our health systems. To date, more than 120 countries and regions around the world are benefiting from the efforts of the Global Fund. In addition, the Global Fund fights AIDS, tuberculosis, and malaria, and recently has added COVID-19, which is devastating all countries, to its portfolio. It has awarded up to date about $4 billion to more than 100 low and middle income countries, also to fight COVID-19, as I have mentioned, adapt HIV and tuberculosis and malaria programs, and urgently reinforce fragile systems for delivering health services. Furthermore, in Africa, which is the largest recipients of the resources coming from the fund. In general, the financial support from the Global Fund has helped avert new infections and achieve the following results. 21.9 million people on antiretroviral therapy for HIV. This date is for 2020. I've not added anything for 2021. 4.7 million people with TB treated in 2020. 188 million mosquito nets distributed till date, figure 2020. Specifically in Nigeria, with the financial support of the Global Funds, we have achieved the following, amongst others. Contributed to 1,536,821 people living with HIV on treatment in Nigeria. And the funds is responsible for life-saving ARVs for 45% people living with HIV and ART for them. Case notification rate that stagnated as 53% increased to 67%, additional 138,000 cases by 2020. 84% increase in TB treatment centers. There is dot expansion from 9,625 in 2018 to 17,699 in 2020, creating more access for TB detection and treatment across the country. The fund has supported optimization of 398 gene expert machines in 36 states and Federal Capital Territory in Nigeria. It has also contributed to decline in malaria prevalence from 42% to 23% from 2010 to 2018. At least 11 million long-lasting insecticide treatment nets distributed annually through mass campaign to general population, including routine distribution to under 5 children and pregnant women. At least 4 million confirmed malaria cases treated annually at public health facilities in 30 states in Nigeria. Knowing the situation of Nigeria with our security issues, we now have IDP camps scattered all over the place. We have 1,381,598 IDP persons. They received parasitological tests, and 1,022,376 cases treated in targeted states in Nigeria. And we are also happy to hand over the torch caravan to Ghana, our closest brother, on the occasion. And we will continue to appreciate all the support Global Fund is giving to us in Africa. So we urge our Ghana brothers and sisters to also share in this celebration in their country and also move the torch ahead. Thank you very much.
Thank you. Thank you very much, Madam First Vice Chair. We appreciate the information, very comprehensive update on how the Global Fund has supported Nigeria. So we will now move on to a short video presentation highlighting the impact of the Global Fund in Nigeria.
Global Fund came in very useful and very helpful in a very difficult period in our health system. COVID-19 outbreak came as a shock to very many countries and shook many health systems, even the health systems of advanced countries. The needs at that time were coming at torrent. The need for PPEs, the need for reagents, the need for commodities of all sorts. And we were very lucky and fortunate to have had the support of Global Fund in emergency procurement of very many needed items. They assisted in getting our gene expert machines into service and in helping to procure a lot of personal protective equipment. And right now they have offered to help us in repairing several of our oxygen generating plants that are not functioning. So it has been a very helpful and useful relationship between Nigeria and the Global Fund. Yeah, the support of Global Fund for Nigeria over the years has helped us to scale up our achievements in the areas that we call ATM, AIDS, tuberculosis, and malaria. As you know, after the NICE survey, we were able to determine our HIV prevalence, and the number of persons in treatment now has reached nearly 1.2 million from an estimated 1.8 for HIV, and malaria has prevalence has been reduced from about 42% to 23%, and we have very significantly scaled up the TB notification in the country. Although all this is thanks to the effort of Global Fund and our health partners who have helped us, particularly the United States of America.
My name is Anita Ikwe. I'm a Nigerian. I'm 22 years. I've been living with HIV since I was born. My mom wasn't aware when she was pregnant of me, so she transmitted the disease to me. The community where I was, so I can't access ARVs there. So I had to travel from that community to the city. It's about 11 hours from where I was to the place.
Nigeria is very complex. It's big and complex. We have 36 states plus the Federal Capital Territory. We have 774 local governments. For us to fix the problem, we need to coordinate all the activities at each of these levels. HealthKeep is the Nigeria Supply Chain Integration Project.
Had three main building blocks: integrated supply chain, operated by private sector, funded by donor partners, and managed by government. As we speak now, 3 programs have already been incorporated into these integrated supply chain. That is the malaria program, the HIV program, and family planning program.
The Global Fund and USAID work very closely. We formulate strategies together. We're able to leverage good global prices. We're able to leverage global contracts together. We have collapsed our supply chain into one, which makes it easier to be able to transition that over to the government of Nigeria. Through NSCAPE, the government is more involved in public health supply chain in Nigeria. The government is speaking to all the donors through one vehicle, rather than speaking to individual donors about separate supply chains.
NSCAPE has built the capacity of all the different states' logistics management coordinating units. As a result, Nigeria as a whole has been able to save about 10.7 billion naira worth of goods in the space of about 2 years.
I would like partners to support us in establishing healthcare from the foundation. Begin at the beginning, which is the primary healthcare system. The primary healthcare center has been redesigned, and it is the foundation for providing health to citizens, particularly in the rural areas and also the suburban areas, and being able to cover a range of services. The government has introduced the 1% of consolidated revenue for the health sector, which is providing the Basic Healthcare Provision Fund for the country at the moment. In addition to that, the government of Nigeria has been urging states to contribute to health financing, and all states have committed to at least 25% of what the Basic Healthcare Provision Fund pays into the health sector. They are working with the National Health Insurance Scheme to bring money also from the insurance space into healthcare, which will increase as soon as the law re-establishing mandatory health insurance is passed. We must appreciate the work of the Global Fund and all those who worked on that idea to gather funds from various sources and support countries who have a high burden of these 3 diseases and establish the disease programs of AIDS, tuberculosis, and malaria. It has taken us a very good way in trying to fight these diseases down. We have achieved a lot more than we would have achieved without that support. So I'm optimistic that with all of that we shall reach universal health coverage by improving the confidence that we have in our own health system.
Okay. Yeah, so we've heard from the Honorable Minister of Health of Nigeria, talking about the impact of the Global Fund since Nigeria became a beneficiary of Global Fund over 17 years ago. And we really are grateful and appreciative of that partnership, particularly in the area of strengthening our health systems, as well as responding to the epidemics of HIV, TB, and malaria. On that note, we want to say we have enjoyed having the torch with us in Nigeria over the past 1 week. And I'm going to ask my colleagues seated around the table to move the torch over for the last few minutes before we hand it over to our first vice chair, who will now officially hand it over to the good people of Ghana. I hope that my colleague in Ghana, Mrs. Cecilia Seno, is standing by. So the torch is moving, its final moments. We will meet in Nigeria before it goes over to Ghana. So now I'm going to hand over to the first vice chair of Nigeria CCM, Mrs. Maureen Onya, who will now blow off the candle from Nigeria's end and hand it over to the good people of Ghana.
Just like my friend said, the torch is moving. Let the light continue to shine in Africa. And of course, across Africa, let this light not just quench. It will be off now, but spiritually and physical, it will just be lit in Ghana. So I hope, who is the person collecting the torch in Ghana?
Can we have our colleagues in Ghana?
Can we hear your voice, please?
Can we hear your voice? Our colleagues in Ghana, Mrs. Cecilia Seno. Okay, so hello. We are officially handing over the torch to you.
Thank you.
Thank you very much to our colleagues from Nigeria. We receive it with joy, and we are happy to hold the torch and continue to let it burn across the country as we also go through a full week of activities to commemorate 20 years of the Global Fund's existence and all the good contribution that the Global Fund has done to Ghana and the world. Thank you very much, and we receive it.
Thank you very much. Now we'll have some few reps of few related or relevant organizations who will give us some remarks. So we would like to call the program manager of NACP. He is here with me, so he will also give a remark.
Thank you very much. It's a pleasure of this year. Vice chair, led by the vice chair, so representing the country director for directors for hospital delivery and all the staff of hospital delivery, the patient of police, and all the ground that our distinguished media partners, distinguished ladies and gentlemen, here and online, in all the countries that I want to assist. It gives me pleasure that I make a few remarks on behalf of the National Security Organization. The contribution and impact of the Global Fund to our national response cannot go unnoticed. The progress we have made so far, the number of people seek for treatment is almost 210,000, and the numbers of people we have supported to know their status and relationship to be monitored on treatment for virus infection are very, very significant. Most significant that we have counted as part of this process of the occasion of the 20th anniversary of the Global Fund. Ghana has a special relationship with the Global Fund from its inception, and I cannot complete my speech or remarks without paying tribute to the late Viviana and whose style the fund was established, who is also very, very illustrious
Ghanaian. So whilst we receive this touch and move the caravan on, It is our aspiration and hope that the 20 years will just be the beginning of greater things to come. We look forward to celebrating the Silver Jubilee, and if God permits, even the Golden Jubilee of the Global Fund. On this occasion, let me indicate that HIV is still real in Ghana. The new infections are occurring to the tune of about 19,000 annually. And about 13,000 people are dying. Between January and June, in the program, we recorded over 900 deaths. So I want to tell everybody that HIV is still real, despite the fact that the face of the epidemic has changed. It's no more a death sentence, and we need to project that positive face. But that doesn't mean that we are complacent. Everybody must know that the virus is still lurking, and it's even killing more people than recent COVID-19. So let us embrace the prevention interventions with special emphasis with the youth, adolescent, young girls, because we notice that new infections in the young people and the magnitude is highest among females. We need to work very hard to protect our young females, because 82% of them, of the new infections in 2020, that is around 5,200, occurred in females. And we need to do everything possible to stem this tide. So ladies and gentlemen, once again on this occasion, I congratulate the Global Fund and all its respective stakeholders. I want to thank all the contributors to the fund whose resources have contributed to saving lives with the delivery of very important interventions in our country. God bless us all. God bless our homeland, Ghana, and make her great and strong. Thank you very much.
Thank you very much. That was Dr. Esiado, the program manager of NACP. Thank you very much. We will move to the woman who is at the head of the table. I think some of us know her very well. Others will meet her today. Please let's welcome Ms. Angela Trente Bonde, the UNA's country director, to give her remarks.
Thank you very much. Good afternoon, partners, colleagues, friends from the Global Fund, Nigeria, partners here in Ghana, Vice President of the CCM, Program Manager, National AIDS Control Program, Ms. Cecilia Seno, Executive Director of Hope for Future Generation, and all of these beautiful young people here in the room. So happy to see all of you. I bring you greetings from UNAIDS and the UN system in Ghana, and really want to congratulate the Global Fund to fight HIV, TB, and malaria on achieving its 20th anniversary. As I think about this achievement, I am filled with hope for the future, with gratitude, deep motivation. The bold and audacious grand vision of establishing a global financing agency to pool together resources to finance the major gaps in HIV, TB, and malaria programs in developing countries was realized. This was the vision of the late and former UN Secretary General, Mr. Kofi Annan. This is another example that a high level of ambition backed by strong political will, political courage, will result in success. UNAIDS is proud of the Global Fund and proud of its partnership with the fund. the Global Fund has helped save 44 million lives around the world and has no doubt changed the trajectory of the HIV response in Ghana. The Global Fund has contributed more than $1 billion in the funding of HIV, TB, and malaria programs in Ghana. It is an example that investing in people, the vulnerable, the marginalized, people who are left behind, is a wise investment which reaps great returns. If we did not have the Global Fund, fewer lives would have been saved. I suspect that we would have had much higher mortality and morbidity. The AIDS epidemic would have truly taken a harder toll on Ghana and African countries without the support from the Global Fund. In addition to securing funding from the Global Fund, countries now have the Global AIDS Strategy under the theme, Fight Inequalities, End AIDS, which is a powerful strategic framework to address the inequalities that drive HIV around the world. UNAIDS and the UN system will continue to utilize its convening power, its influence, its position as an honest broker, its technical expertise, wealth of knowledge on global best practices, its policy and data analysis expertise to make the Global Fund money work for the people of Ghana. Let us continue to support the Global Fund to fight HIV, TB, and malaria in the spirit of global solidarity and shared responsibility. As the UNAIDS Country Director for Ghana, I am very pleased to be in the team to receive the torch Caravan from Nigeria. For me, this torch represents a beacon of light and hope which the Global Fund has brought to millions of people around the world who are affected by HIV, TB, and malaria. We will let this light shine as we go about the business of ending AIDS, TB, and malaria in Ghana. Once again, happy 20th anniversary to the Global Fund and to all of us, indeed. Thank you very much.
Thank you very much. We'll take a remark from the CCM Vice Chair.
Country Director of UNAIDS, members of the CCM here represented, Program Manager, National AIDS Control Program, representing implementers from the government sector, members of civil society groups who are here, and then young PLHIV group that is also here. You're all welcome to today's event. I'm honored to represent the chairman of the CCM as a Minister of Health for the Republic of Ghana, Honorable Menu, who unfortunately cannot be here today because of other commitments. And I'm happy to sit here to represent him, to receive the torch from our brothers and sisters in Nigeria. It's interesting that today, 22nd of October 2021, is a landmark day for us as we commemorate 20 years of the Global Fund. 22nd November 2002 was the day that Ghana signed the first ever Global Fund grant allocation to any country in the world. And that grant was for an allocation of $7.2 million for HIV/AIDS and TB prevention and treatment. We are all aware that the Global Fund is the brainchild and the excellent work of our own, the late Secretary General of the UN, Mr. Kofi Annan, and also the work of other partners and governments like the US government, the UK government, the Japanese, and all the other G8 countries, and then organizations like the Bill and Melinda Gates Foundation. At the time, this first grant was to ensure that 2,000 Ghanaians received life-saving HIV/AIDS medicines. And then also about 20,000 TB patients were enrolled on treatment in both the public and private sectors in Ghana. The grant was signed by the executive director of the Global Fund then, and for the Global Fund, and then Dr. Jehu Appiah, who was then chairman of the Coalition of NGOs in Health, along with Dr. Kwekwe Friye, who was Minister of Health at the time. 20 years later, the narrative has changed significantly, and we are happy to say that at the last grant, Ghana was allocated in excess of $304 million for TB, HIV, and malaria interventions in facilities and in the community, including both private sector and public sector interventions. Well, happily, the actors are similar to what happened 20 years ago. Mr. Mark Eddington from the Global Fund side, and then the Minister of Health of Ghana also signed for Ghana. And this is even aside, this 304 million is even aside the over 65 million that has recently been allocated for the national COVID response by the Global Fund. Indeed, Ghana as a country is extremely grateful to the contribution of the Global Fund for our health systems and disease response. So we are happy to say that over the period of those 20 years, what has been the benefit that Ghana as a country has received from the Global Fund. We have seen over $1.2 billion in allocated funding for life-saving treatment for TB, HIV, and malaria, for prevention interventions, for testing reagents and test kits, for prevention strategies, including condoms and community education activities, for malaria prevention and bed nets distribution, to strengthen our health system, to be able to support program implementations, and then recently with COVID, to be able to even beef up our health system's response to pandemics, including treatment and care options with the provision of oxygen systems in the various health facilities. In as much as we have received all this, we know we will need more. And so, as a country, we're positioning ourselves to be able to also contribute and give more to the Global Fund in order to be able to also receive more from the Global Fund. The government of Ghana has been significantly positioned to also contribute its counterpart funding in support of Global Fund interventions in Ghana. We take this opportunity on the 20th anniversary of the Global Fund to say that we want to do more. We want to spend this 2-week period of moving the torch around the country to create a needed awareness of the Global Fund and its role within our health system in Ghana. And hopefully, we believe that by the time the torch is leaving us and moving on to the next country that will receive it in 2 weeks' time, we would have created enough awareness, we would have mobilized everybody's response, and would have mobilized some resources to contribute to the work of the Global Fund in Ghana and around the world. Thank you very much for the opportunity. Thank you very much for all of us here present, and we look to a good time. Thank you.
Thank you very much. I know you can do it better because I know you very well. Thank you very much, Vice Chair of CCM. I think he touched on a lot of things that Global Fund has done and the amount of monies that we've received for programming. You know, all that money also translates into saving lives. So I'd like us to say thank you to Global Fund. And we'll all lift our hand like the woman in the t-shirt or the person in the t-shirt. So please, let's do it. Thank you, Global Fund. Once more, thank you, Global Fund. Thank you very much. Now we'll take J-Fund.
Say all protocols observed. My name is Tabet Sitimbe, representing Waki Health. We are the Global Fund Advocates Secretariat and coordinator of this Torch Caravan. Celebrating Global Fund at 20. We are so excited to welcome you all. We appreciate the participation and support from all African countries who have and will are still to host the torch in celebration of the Global Fund at 20. The Global Fund's presence and impact in Africa extend not just to the Republic of Ghana, nor Nigeria, but to the continent as a whole. In honor of the Global Fund support for Africa in its totality over the last 20 years, the Torch Caravan is making its way through Africa, taking on the Cape to Cairo routes, being passed from country to country across several African regions. The Torch Caravan is a great opportunity to raise awareness about the disease burden and show our appreciation for the Global Fund's interventions in fighting AIDS, tuberculosis, and malaria. Even with the issues like political unrest and COVID-19 restrictions experienced in different countries in Africa, we stand together in solidarity and continue to shed light on how to improve lives. We acknowledge the dedication and hard work that is contributing to the success of the hosting of the torch by different countries since its launch on July 14 in Southern Africa region, crossing over into East Africa region, into Central Africa region, into West Africa region, and today the torch has made its way to Ghana. So we are so grateful for the civil society, the communities, the representatives, and the impact that this Torch Caravan has had, just to highlight the role of the Global Fund throughout our beautiful continent of Africa. So the Torch Caravan will continue on its journey, and from Ghana, it's going to be passed on into the MENA region, starting off with Morocco, then it will go into Tunisia, then to Egypt. From Egypt, the caravan will be journeying back to South Africa, where it's going to be received at the CASA conference in Durban on the 8th of December 2021. We are hopeful that everyone who has participated in this transition from Cape to Cairo route will be able to celebrate with us when the torch arrives back in Durban on the 8th of December. We celebrate with you today the Republic of Ghana, as you have received the torch and host the torch today, being passed on to you by the Republic of Nigeria. We also still celebrate and embrace the many other previous hosts and the future hosts of the continent. We wish you all the best. This beacon of light is now in your midst. Hala, hala, Ghana, we celebrate you. Hala,
To first of all congratulate Global Fund on their 20th anniversary. Global Fund has done a lot, so it's by way of making sure that people who are living with the disease are playing a major role within their community and finding the missing people with TB. I must say that Global Fund has saved a lot of lives, millions, about 38 million lives,
through which I'm one of them, and I've survived TB in 2011. I must say that without Global Fund, a majority of our community members wouldn't be alive today. So we say congratulations, and then we say thank you to Global Fund for the good work you are doing for the community and saving lives. Ayiko to Global Fund, and we wish you all the best, and we wish that better, more collaboration within the community members are engaged within the Global Fund.
My name is Irene Bodo, a member of the Ghana Network of Persons Living with HIV. The Global Fund's partnership with Ghana has been of tremendous benefit to PLHIVs, persons infected and affected with tuberculosis and also malaria. Global Fund has been of great support to Ghana as a country in terms of helping to strengthen our health system and also helping to build the strength of community members to lead interventions themselves. As we mark the 20th anniversary of the Global Fund, we believe that people's lives will continue to transform based on the care and treatment services they receive in relation to HIV, tuberculosis, and malaria. Individuals, groups cannot do it alone. Civil society cannot do it alone. And so that is why the Global Fund, with support of the government of Ghana, hopes that the interventions and activities of the Global Fund will continue to transform lives to ensure that all Ghanaians benefit from quality health care through its activities. The beat continues.
I am Dr. Kezia Mam. I'm the Program Manager for the National Malaria Control Program. Global Fund has been supporting us over the years. I think in Ghana, Global Fund started with a malaria program in 2002. Ever since then, it supported us in scaling up very needed interventions to the people of Ghana. If you look at 2002, when we started, an intervention like intermittent preventive treatment for pregnant women was just implemented in 20 districts. As of now, it's in all districts of the country. We have Global Fund supporting indoor residual spraying in 3 regions in the country. Insecticide-treated nets, one of our key preventive interventions, is being distributed across the entire nation. And we've seen a great improvement in the use of nets. In 2000, we had just about 4% of the population using these nets. In 2018, when we had our last survey, you can see that between 50 to 60% of the population is using the net, depending on where and which target group. So we've really had a great support from Global Fund, not just in the preventive aspect, but in the management of those who fall sick. And this has considerably reduced our admissions. If I just take in the recent years, for example, from 2012 to now, we've seen a reduction in admissions of about 28%. As for our death, I think it's a big part on the shoulders of all our partners, including Global Fund and ourselves. We were recording around 14,000 deaths in the early 2000s. In 2012, our record showed that we had about 2,700 deaths reported in our health facilities. Last year, we recorded just about 300 deaths. So there's been great improvements in our malaria indicators, and all support we receive from our partners, including Global Fund. Global Fund has been a key supporter. And I think it would have been difficult without the support of Global Fund, because when it comes to the actual goods and services, Global Fund is our #1 supporter. So we are very grateful to Global Fund. And as Global Fund is celebrating its 20th anniversary, we wish, I think when we are wishing Global Fund well, we are wishing ourselves, because Global Fund is working with us, and we feel that in a way, we are part of Global Fund. We continue to pray that they will continue to get resources to support us and meet us at the point where we need them most, so that eventually malaria will be a thing of the past. Wish you well, Global Fund, and happy celebrations.
Angela Trenton Mbonde, the Country Director of UNAIDS Ghana. Congratulations to the Global Fund to Fight HIV, Tuberculosis and Malaria on achieving its 20th anniversary. The vision of a global financing agency to pool together resources to finance the major gaps of HIV, TB and malaria programs in developing countries was grand and ambitious. This was the vision of the late and former United Nations Secretary General, Mr. Kofi Annan. Mr. Annan's legacy through the Global Fund has helped save millions of lives and has no doubt changed the trajectory of the HIV response in Ghana. The Global Fund has contributed more than $1 billion in the funding for HIV, TB, and malaria in Ghana. If we did not have the Global Fund, fewer lives would have been saved. I suspect that there would have been much higher mortality and morbidity. The AIDS epidemic would have truly taken a harder toll on Ghana and African countries without the support of the Global Fund. With the global funding secured, we will utilize the new global AIDS strategy to fight inequalities and end AIDS, to address the inequalities that drive the HIV epidemic around the world. We are grateful for the support of world leaders in both developed and developing countries for committing to contribute to the fund and then delivering on their promises. Let us continue to support the Global Fund to fight HIV, TB, and malaria in the spirit of global solidarity and shared responsibility. We are grateful for the support of world leaders in both developed and developing countries for committing to contribute to the fund and then delivering on their promises. Let us continue to support the Global Fund to fight HIV, TB, and malaria in the spirit of global solidarity and shared responsibility. Happy birthday, Global Fund. I am one of the 44 million lives saved.
My name is Dr. Stephen A.C. Addo, the Program Manager of the National AIDS and STI Control Program of the Ghana Health Service, Ministry of Health, the lead agency for the fight against HIV and AIDS in Ghana. On this occasion of the 20th anniversary of the Global Fund to fight AIDS, TB, and malaria, I have the pleasure to pay glowing tribute to our illustrious late son, Kofi Annan, under whose watch the fund was established, and very thankful to the Global Fund for the continuous injection of resources to build our health system in the areas of the three diseases. Ghana has been a great beneficiary to the fund and benefited through the different cycles to the current NFM3. And I must establish that the investment has contributed to an improvement in our human resource in terms of the numbers and the capacity and the quality. It has contributed to a building of our infrastructure, massive injection in various infrastructure, including equipment. It has also contributed to an increased flow of commodities for people living with HIV. As we speak now, there are about 226,000 people live on treatment in Ghana. It has also led to an improvement in our health system, in our logistic management information system and strategic information system, the deployment of the e-tracker. It's very essential to note that without the investment, Ghana's health system wouldn't have come this far, and the effort to achieve our 95 aspirational target would have been a mirage. So I commend everybody and all the countries who have continuously contributed to make this a reality, and encourage all of us to do everything to protect it, to ensure that the progress we have made is does not become a 9-day wonder. We can ensure sustainability by making sure that all the achievements have some local capacity and ownership. We have to ensure that the sustainability issues are answered in terms of building the country's own health system to be able to continue in the efforts that we have made so far. So on this occasion, I want to congratulate all and sundry and every stakeholder whose efforts has brought us this far. And I wish the Global Fund a very, 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 very happy platinum anniversary.
The Global Fund is 20 years old. Hooray! My name is Richard Socrates Ajesi, an MDR TB survivor and also the administrator for TB Voice Network. TB Voice Network is an organization or a community of persons affected and affected with tuberculosis. Through the support and activities of Global Fund in Ghana, the TB Voice Network has been engaged in active case finding. We follow up on lost cases and bring them back on treatment. We follow up on defaulters and bring them back on treatment. This has helped to save so many lives over the years. On the occasion of 20 years of the Global Fund, we want to use this opportunity to wish them the very best. We pray for prosperity unto them. I want to say the beat continues.
Today, I joined the World to celebrate 20 years of impact on HIV, tuberculosis, and malaria, and building of stronger health systems. The beat continues.
Thank you. Mrs. Elsie Ayenaplas, President, will give us her remarks.
Thank you very much. Vice Chair of CCM, UCD, Program Manager, NACP, colleagues, community members, the media. It's a great pleasure to be part of celebrating the 20th anniversary of the Global Fund. I wonder where we all would have been without the Global Fund intervention. I wonder what thoughts came into the minds of Bill Gates, Melinda French Gates, our illustrious son Kofi Annan, Jeffrey Sachs, and the other two who together were the founders who brought about this idea of a global fund for health. We can attest that over the years, the Global Fund has achieved a lot of what it had planned to achieve for HIV, TB, and also malaria. As a member of the HIV community, we have seen a lot of institutional capacity building that we as NAPLAS Ghana have received. The TB Voice Network and the other communities have received from Global Fund. We have received capacity building. We have a lot of pocket lawyers, as we call the paralegals. We have the experts, models of hope, who have worked tirelessly to give hope to those who test positive, to those who think that their lives had come to an end. We have seen the young people also coming up and taking their rightful place in the national response. And all this had been made possible through Global Fund. So this 20th year, we cannot but join everyone else to say, AICO Global Fund, thank you. You came in at the right time. You saved lives. You increased understanding. You helped us, our institutions, to also be able to give the quality service that they had pledged themselves to give. And we are very grateful for this. Thank you very much, Global Fund.
Thank you very much, Madam President. Now we take our closing remarks from Mrs. Cecilia Asenu, Executive Director of Hope for Future Generations and a Global Fund Board member. Thank you.
Okay, so CCM National Vice, Program Manager, NACP, UCD, UNAIDS, colleagues, TV Voice Network, NAPLAS Ghana, YAG, colleagues, civil society organizations, the media. You all agree with me that today's program has been very successful with support of all of you. We would like to thank the CCM, the Vice Chair and the Secretariat for supporting this. We would like to thank all of you. A lot has been said about the work of the Global Fund. You all agree with me that in 2002, when AIDS, HIV and AIDS, TB was a death sentence, if Global Fund did not support us with the government of Ghana and all of us behind it, many of us wouldn't be alive today. And so we are very grateful to that. A lot is happening in the global world with the support of governments of Ghana and all African countries supporting TB, HIV, and malaria. As the Global Fund is preparing to start its 7th replenishment, to mobilize resources to continue to support TB, HIV, and malaria, civil society organizations, communities, governments are all calling on donors, development partners, to put adequate resources to support the Global Fund, because we believe that Global Fund is one institution that can change lives. It has already changed 44 million lives, and it's still changing lives, strengthening our health systems, strengthening our community systems, supporting our government. And so as we continue to celebrate the 20 years of the Global Fund, we continue to call on donors, development partners, governments to resource the Global Fund, to donate adequately to the Global Fund and support TB, HIV, and malaria in our countries. We are so grateful. The candle is with us. The Caravan is with us. I know Ghana has a lot of plans, and I know all of you, wherever you are in Africa, will continue to support us. We are celebrating the Global Fund for 20 years of changing lives, supporting and strengthening our health systems, and they are still continuing to do that. I am just grateful. I want to thank our team, the program manager, CCM Vice Chair, Dr. Ninote, Angela, UCBUNAs, Jerry Amwalabi from TB Voice, and all of you for supporting and planning for this program. Thank you very much, and we continue to celebrate. Thank you. Okay, so I learned our colleague Global Fund is online and would like to give a speech. We give them a time to say something. Hi, Cynthia. Thank you.
Good afternoon. It's so heartening to hear the voices, to hear you speak, and to hear you relate to the Global Fund. And sometimes, you know, when we are talking, we talk about the Global Fund as if it was an organization somewhere out there. But actually, the Global Fund is this partnership.
I would like to thank the GFAN Africa for the leadership that you continue to provide. I would really like to thank the Journalists Against AIDS and all the colleagues in Nigeria who have been working on the Torch Caravan. And many thanks to our colleagues in Ghana who will be taking over the Torch and organizing events around it in Ghana. As you know, the Global Fund, as has been said before, is a partnership. It's a partnership between governments, a partnership between private, a partnership between technical partners, a partnership between. Are we okay?
Yes, we are.
All right,
Yes, we
I'll
are.
continue. I'll continue and assume that everything is fine. I was saying that Global Fund is a partnership, and it includes in equal measure communities and the civil society. And I'm sure that you've done this retrospection, looking back and saying that, you know, by the time we got to 2000, we were faced with unnecessary deaths. Households were being pushed further into poverty as they tried to get hold of ARVs that would save life. And I just want to reflect that at that time, the Ghana civil society had been already galvanized because of the work that you had been doing under the Structural Adjustment Participatory Review Initiative. And you were so organized, you showed cooperation among civil society organizations that had previously not been working together. You brought to the HIV fight your ability to be representative to many parts of the country, and you used this powerful voice to call for a game changer. So that's the first thing. From the civil society, the voice that was coming through was, give us something that changes the terms of the game, that changes global inequality. At the same time, from the world leaders, also another voice coming from Ghana, and you've heard this story so many times, was Kofi Annan calling for a war chest, a war chest. So we had a voice calling for a game changer, we had a voice calling for a war chest. And the governments also in Africa came together and were calling for a global solidarity fund. These three voices and others were where the Global Fund was born. And as you know now, that was 20 years ago. Through your activism, today we're celebrating 20 years of saving lives. To this day, the Global Fund has managed to continuously mobilize resources and save 44 million lives of our brothers, our sisters, our mothers, and our fathers. I would say, and cousins and aunties, but as you know, amongst us Africans, there's no cousins and aunties. There's just brother, sister, father, and mother. Thank you so very much for your support and for holding us accountable. You know, we are now faced with another challenge that threatens the gains that we've made in these 20 years. We have the reality of another pandemic, and it won't be the last one, unfortunately. We need to help our countries to get back on track and to prepare better, and we need our communities to be prepared for future pandemics. We need our healthcare systems to be stronger and more agile in how they respond. We need to revive our economies to ensure that we have enough resources to be continuously allocating to health. In the meantime, a happy anniversary to the Global Fund partnership and family. To my Nigerian family, I thank you now well, and God bless you for having held the torch. And to my family in Ghana, Nyamen Shiramo for taking on this job. Mesdames, Sepa. Thank you.
Thank you very much, Cynthia. We've come to the end of our program. My boss, Mrs. Cecilia Senu, has already done the most of that. So we say thanks for it. Yeah, the celebration goes on.
I believe, Mama Africa, you'll be free. I believe, Mama Africa, you'll be free. From HIV infection, the race of tradition, and new methods of prevention.